Diabetes happens when our body does not make enough insulin or does not use insulin properly. This causes our blood glucose or blood sugar to be high. Glucose is the body's main source of energy. After eating, food turns into simple sugars called glucose. In people without diabetes, glucose stays in a healthy range because insulin is released at the right times and in the proper amounts. Insulin works like a key, unlocking the door of a cell so that glucose can enter and be used for energy. When glucose and insulin are in balance, the blood sugar level stays at a healthy range. In people with diabetes, blood glucose builds up for several reasons. With type 1 diabetes, the pancreas makes no insulin. With type 2 diabetes, cells do not use insulin well, or the pancreas does not release enough insulin to meet the body's needs. The imbalance of insulin results in high blood glucose levels. Let's discuss the symptoms of hyperglycemia or high blood sugar, when to take action, and how to check for ketones. Common symptoms of high blood sugar include feeling extra hungry, increased thirst, frequent urination, fatigue or sleepiness, blurry vision, mood changes, infections such as yeast infections, slow wound healing, and dry skin. If you experience any of these symptoms, check your blood sugar. Take additional action if your blood sugar is above 250 or if you are feeling sick. High blood sugar can be dangerous, especially if ketones are present. Be sure to continue taking all prescribed insulin doses even if blood sugar is not above 250 or ketones are not present. Check for ketones if your blood sugar is 250 or greater before eating or greater than 2 hours following a meal. Or if you feel sick with fever, cold, flu, diarrhea, or vomiting, or if you have a headache, stomachache, or just feel unwell. To check for ketones, dip the ketone strip into your urine and remove it immediately. Let the strip stand for 15 seconds and compare the strip color to the chart on the bottle. If the test shows positive ketones, call your healthcare provider immediately or follow the ketone treatment guidelines in the high blood sugar section of your diabetes notebook. For urgent concerns, call the 24-hour Bonheur diabetes number, 901-287-6659. Ketone strips must be stored properly. Keep in mind that open ketone strips are good for 6 months, and unopened ketone strips are good until the manufacturer's expiration date. Always store test strips in a dry location and keep the cap tightly sealed. Managing high blood sugar is key to staying healthy. If you ever feel unwell or notice high blood sugar levels, take action right away. For more information, visit lebonheur.org or talk to your healthcare provider. Stay safe.